Hi, my name's Debbie. I'm one of the prescribing support pharmacists in the Wishaw locality.
And I'm Rory. I'm also a prescribing support pharmacist in the Wishaw locality.
And we're looking to tell you about our polypharmacy clinic and falls project. So yeah, there's a couple of questions to answer.
Yeah, so what was the aim of your project?
The aim of our project was to reduce the falls risk for patients through a holistic polypharmacy review. So we identified patients who we considered at risk of falls, be them on medicines which put them at an increased risk of falls, specifically medicines which have an increased anticholinergic burden, and patients who we identified with an increased risk of falls or through a high fragility score. The next question we have is, what did you do in your project and how did you do it?
So, as Debbie mentioned, we were wanting to do holistic polypharmacy reviews for patients that we'd identified. We used the Scottish Therapeutics Utility Tool, or STU tool, to identify these patients. We then invited them in using a letter that we had a template for, to invite them into a face-to-face clinic or a phone call if appropriate, that we would then invite them in and do a full medication review, touch on any other issues they might have and help them with that. So who did you involve in it?
Involved in the project was ourselves, the two clinical pharmacists who are based in the GP surgeries involved in the project. In addition, we involved the wider pharmacy team, in particular our prescribing advisor in designing the project, the admin staff in the GP practices too, to help us arrange the clinics, bring the patients in and arrange their follow-up. What QI tools did you use?
So at the start of the project, when we'd approached the QA team and we got our prescribing advisor Damien involved in it, we'd obviously identified that there wasn't any point in just doing the reviews without properly looking at it and going about it from a quality improvement point of view. So we're happy for the input from that. So we used things like driver diagrams, models for improvement and process mapping to lay out what we wanted to do, what we wanted to achieve, and then what would be measurable at the end of the reviews, just as a way of sort of quantifying the reviews that we were doing.
Great. What would you say was the most challenging part of your project?
Challenging wise was just the sort of logistics around that. At the start, we started doing desktop reviews for the patients. Quite often they were going into quite a lot of detail, put a lot of effort into it, and then the patients might not turn up to the appointment. So it took a wee while to get into a role of sort of streamlining exclusion and inclusion criteria to make sure that we're inviting the most appropriate patients. It was challenging as well because we were sending letters and we weren't always getting word back, and I think we ended up seeing roughly about a fifth of the patients we contacted. And then there was limits on clinic time and space, so we were limited to a Wednesday afternoon and roughly about 4 or 5 appointment slots. So depending on the amount of patients coming in, we didn't have a lot of clinic time or availability for them as well. So that definitely things that could be improved as we go forward if we were to do this as a wider sort of scale project. But we managed to overcome most of the challenges along the way. Question number 6, what are you most proud of?
I think I'm most proud of being involved in getting patients in to restart these holistic polypharmacy reviews to review their medication. Particularly over the last few years, that's not been something that has been practical and being able to do, and we know that medications do pose a significant risk of harm to patients on occasion, and are, for example, a significant cause for admissions to hospital, for example. So I think being able to be involved in bringing people's risk of harm from their medicines, and particularly for these patients reducing the risk of falls, has been really positive, so I'm proud of that. How about you?
Yeah, so I think for us, or for me, sorry, rather on a personal level, it was more just the patient feedback and the engagement from them. Everybody that we seemed to see were really delighted with the service. Quite often they had a lot of issues that they've had nobody to sort of breach them with over the last couple of years, especially with COVID, and they liked the opportunity to come in and discuss their medications and their conditions, and quite often they're quite receptive to a lot of the information and the changes we were making. And I felt we were making a good impact for them, so that was rewarding.
Yeah, I think it's also been great to be able to champion and demonstrate our role as clinical pharmacists in primary care, how we can use our role and improve the quality of care given to patients, as well as in this current climate that we're in, helping reduce medication waste, as well going forward. So I think a lot of positive things have came from this.
Definitely.
Yeah. Okay, thank you.
Thank you.